was a sight for my soul.
Welcome to the Inspired Evolution, and it is a treat to be here today. We have with us Dr. Harry Adelson. Harry, how are you, mate?
Fantastic. Thank you so much.
It is so good to have you here. For those tuning in to Dr. Harry Adelson for the first time, give me a quick sec to do the honors. He was one of the very early adopters of stem cell therapy, and he adopted this for the use of chronic spine pain. He's performed over 6,000 stem cell procedures. He's injected stem cells into over 700 invertebrate discs, placing him solidly amongst the most experienced in the world with the use of stem cells for the treatment of chronic spine pain. He opened Docere Clinics in Salt Lake City in 2002, and from day one, his practice has been 100% regenerative injection therapies for the treatment of musculoskeletal pain conditions, right? And through Docere, Dr. Adelson has performed over 4,000 bone marrow and adipose-derived adult stem cell procedures, placing him among the most experienced in the world with the use of stem cells for treatment in the musculoskeletal pain conditions. His practice is in Park City, Utah, and that's where he's dialing in from today. Mate, thank you so much for taking the time to be with us here.
Oh, you're most welcome. Thank you for having me.
I'd love to start just at ground zero. Where did this, you could be practicing on a million different things. You're an intelligent man. What brought you to stem cells?
Well, originally I went to naturopathic school because I wanted to go up against big food. I saw what was happening with the food industry and obesity. Mm-hmm. And so that was my original motivation. But then when I got to naturopathic school, I was completely fanatical about rock climbing. My whole life revolved around rock climbing.
Yeah. And
I was training for a trip to France, and I did this sort of cross through move in the gym and felt this pop in my shoulder. And I saw a surgeon, and he said, well, you've torn your labrum. I can put a scope in there and cut away that cartilage. It'll probably help you in the short term, but it's going to give you problems later in life. Alternately, I could give you a steroid injection, which will probably give you pain relief in the short term, but it actually is going to make the problem worse because it actually further degrades the cartilage. And I thought, those are both terrible options. Here I was in naturopathic school. I was 25 years old. I was in excellent health. Yep. And so I knew there had to be some other solution. Mm-hmm. So I started asking around, and this was, back in the 90s when doing research meant you actually had to talk to people. Mm-hmm. And I came across a guy named Rick Marinelli, who was the first naturopathic doctor to do a treatment called prolotherapy. And mm-hmm. prolotherapy is the injection of natural substances that are simultaneously nutritive and slightly irritating. And what it does is it essentially tricks your body into thinking that you've had a new injury, but you haven't caused any tissue insult, thereby launching the body's natural healing cascade. And I had it done to me, and it worked so well that I knew that's all what I wanted to do. So I started doing that, and I did that for the first 6 years. I just did prolotherapy, injecting really just like dextrose, sugar water. Mm-hmm. And it worked very well. We'd have to do a lot of treatments. Frequently I do between 6 and 12 treatments spaced out over a year. Mm-hmm. And then we learned about platelet-rich plasma, which is you draw blood, you concentrate down the platelets. Mm-hmm. Blood is comprised of the serum, which is the fluid, then the red blood cells, the white blood cells, and then the platelets, which are cellular fragments that everybody knows are responsible for clotting after injury to stop the bleeding. But once they activate, they release these proteins that actually activate your own stem cells to go into healing mode. So I started using that. I started experimenting with that, and it worked. I was able to get the job done in half as many treatments as prolotherapy. I did that for a number of years. And then I had a patient come into my office and say, I want you to put bone marrow stem cells into my knee. And I said, Laura, I don't know how to do that. I had heard of it, and I knew there were a couple of guys back then. There were just a handful of people in the US doing it. I said, but I don't know how to do it. And she said, so learn. I said, Laura, I'm a naturopathic doctor. Do you know how much flack I'll get if I start doing bone marrow aspirations? And she leaned forward and she said, I'm a materials engineer for NASA, and I'm a woman. So if you want to complain to me about people telling you you're out of your league, I'm afraid you're talking to the wrong person. And I couldn't argue with that. So I learned how to do a
Thanks,
bone marrow
Laura.
aspiration. It really wasn't that hard. And I started doing it, and it worked so well that I
Yeah.
knew that's all I wanted to do.
I love that. And that's what you've been doing for
Since 2010.
I love that, man. Thank you so much for sharing the
Yeah.
background to that. I'd love to sort of pry into a little bit around the root here, because the bone marrow aspirations, there's still not like, now there's more people doing it. Now it's 2021. But when you first started, and even now, there's not that many people doing it really. We're talking about something that is actually quite cutting edge. But I also want to kind of pair that with your perspective on the world, because you've started off as a naturopath, right? And naturopath is all about the healing power of nature and the body's ability to heal itself, right? So how do we, I'm trying to reconcile the two things there. It's like, it's kind of like the nature heals itself, and yet there's this, this cutting edge nature of, can you help us with the dance between those two?
Sure. So let's talk about, what happens after you get injured. So you have some sort of injury. Say you have like either an acute traumatic injury or just sort of repetitive stress. Playing tennis on a concrete surface for 20 years gives you arthritic ankles and knees and possibly hips. Or, doing a weightlifting maneuver and you slip a disc and you actually dehydrate the disc. You have damage to the connective tissue. And when you have damage to the connective tissue, the microscopic anatomy of that tissue actually undergoes changes. Right. The collagen fibers that are normally these, nice symmetrical patterns become irregular. So now instead of your miracle fabric, stretching just the right amount in every direction, they lose their miracle properties. They stretch too much in some directions and not enough in others. And they fire these pain signals because the nerves that pass through those tissues are getting held up. Compressed. The other thing that happens when you have what's called suboptimal healing is you get a process called neovascularization. And that's the growth of irregularly formed blood vessels. It's a hyper concentration of irregularly formed blood vessels. So you might think, oh, more blood vessels, that means better blood flow. No, it's the opposite. There's two problems with neovascularization. One is every time you grow a new blood vessel, you grow a new sensory nerve along next to it. So now you have a hyper concentration of sensory nerves. And these are irregularly formed blood vessels. So instead of improving your body's ability to bring nutrients such as oxygen to the area and metabolic waste such as carbon dioxide away, you actually lose that ability. So now you get what's called hypoxic pain. It's like, there's not enough, you don't get enough oxygen to the tissues. So that's, that's what sort of is what we know is largely the pain generator for people who are living with chronic pain. Well, the way your body heals itself after injury is we have stem cells in all of our tissues, in the muscle, in the fat, in the bone, in the joint surfaces. And when you undergo an injury, those stem cells activate to launch a healing cascade. When you have healing after injury, it's a stem cell mediated event. So it works to a point, but if you don't have complete healing and you have suboptimal healing, then you have a chronic pain syndrome. And those are the people that I see. So what we do is we take the stem cells from places where you still have a robust population, such as your bone marrow and your fat, and then we inject them into the area that's been damaged, thereby launching the body's natural healing cascade, tricking the body into thinking there's been a new injury, launching the healing cascade, getting a second chance at healing.
Amazing. Thank you so much for sharing that. You keep referring to the term healing cascade. There's a sequence that your body goes through that when it's healing. Is it long-winded and complicated, or can you share it with us here today?
I can make it very simple. So essentially, you have some sort of insult. So say some sort of traumatic injury. First, you go through an inflammatory stage, and that's where, the platelets come to the area, release these proteins. And, and what we have to keep in mind is, especially in the days of COVID, we're talking about inflammation being a bad thing. Well, you need inflammation. I mean, inflammation is a necessary step in a normal healing response. When it becomes problematic is when that when that inflammation gets out of control, when it's too much. But a normal controlled inflammation after an injury is a necessary part of how your body heals itself, which is exactly why anti-inflammatory medications such as ibuprofen really sort of is working against you, because by the same mechanism by which it's blocking the pain, it also disallows the normal healing response to occur. So first you have this inflammation, then the inflammation subsides, and then you get the tissues start to weave themselves back together, which is called the remodeling phase. And that takes up to a year. So really, you don't know the full result of an injury until you're a year out, because it could completely resolve. Similarly, with stem cell medicine, we do the treatment, and it's sort of the opposite of a steroid injection. A steroid injection, if it's indicated and it's done properly, gives somebody immediate pain relief, but then it only lasts a couple of months and then it completely goes away. With stem cell therapy, because we're targeting actually changing the microscopic anatomy of these connective tissues, it takes time. It's like you plant a garden and then you got to wait for the plants to grow, similar to that. So we do the treatment and then we wait. I don't really expect any improvement until 2 to 6 months out.
Gotcha. And you're saying planting the garden. I'm aware that the process, the procedures themselves are quite intricate and quite evolved. You're like threading a needle between some really intricate bits of the body. Can you explain maybe the first place to start is, what are the most common places that you're treating people? Is it neck and shoulders? Is it lower back, that sort of stuff? And then from there, what does the procedure kind of look like?
Sure. So we focus on spine. Low back pain is the #1 leading cause of disability worldwide.
Whoa.
One in 4 people experience low back pain at some point in their lives. We do a lot of spine, we do a lot of neck, and that's really what sets us apart. It's just been my interest since the very beginning, and I just absolutely love treating it. I love treating it for 2 reasons. One is because conventionally, there's very little to offer. There's sort of this spectrum of people with back pain. And on this end, you've got the people who respond really well to chiropractic and acupuncture and, the sort of non-invasive modalities. So they don't need me. And on this end, you've got the people who really do need surgery, the people who their spine is unstable and they're at risk, and they are true surgical candidates. But then there's this huge group in the middle that sort of just fall through the cracks. And those are the people who we tend to have the best outcomes with. We do a lot of work with dehydrated discs, desiccated discs where the intervertebral disc actually, becomes dehydrated. We do a lot of post-whiplash syndrome. And then we do a lot of just garden variety osteoarthritis. People have been athletes their entire lives or sedentary their entire lives, and their joint surfaces are degrading.
And so the actual procedure itself, you're going into the bone marrow, can you describe us a little bit in terms of how it goes step by step?
The most important thing to keep in mind here is we do all our procedures under IV sedation. So we have an anesthesiologist put people to sleep. So as I describe this stuff, realize there's no pain involved. Everybody's asleep. So this is totally mellow, calm. It's really funny because when I first started doing this, the sedation used to be optional. I used to offer it to people, but it was an additional charge. And what I found was that when I would talk to people on the phone 6 months later, the ones who chose to not be sedated because they wanted to save the money would, I'd call and say, "Hey, this is Harry Adelson in Park City." And they'd go, "Oh, hello." Obviously pissed off at me, clearly, and I was sort of going, I started asking him, "So, how are you doing?" "Oh, it didn't work." "Oh, really? Okay. Well, can you go up and down the stairs?" Yeah, actually I can go up and down the stairs now." "Oh, because here it says you couldn't go up and down the stairs before." "Oh yeah, but I started doing yoga and I'm pretty sure that's what did it." And finally, the light turned on and I figured out that these people were mad at me because I had tortured them. And because that never happened with people who I sedated. So then I just adjusted my price so it included sedation. Everybody goes to sleep and that never happens anymore.
Gotcha.
Everybody's happy to talk to me.
Yeah.
So first of all, people go to sleep. Then we do the lipoaspiration, which is like a miniature liposuction. Even if somebody is pretty slim, only the skinniest, like 4% body fat, raw food vegan. Like I won't even attempt, like Ben Greenfield, for instance. I didn't even attempt it with him. He's ready to go on stage at any minute. So I didn't even attempt it with him. But most people, if you can pinch a half an inch, I can get fat out of you. Then we do the bone marrow, which again, person's asleep, place a needle in the ilium, which is the big flat frisbee shaped bone in your pelvis. Both fat and bone marrow are very rich sources of stem cells. Now, the issue as we get older is what makes our stem cells old is our stem cells lose the ability to manufacture and excrete these vesicles filled with growth factors that are called exosomes.
Yeah.
And exosomes are the actual active ingredient of stem cells. So what we do is we take the person's stem cells from their bone marrow and fat, and then we supplement with these exosomes that we get from placental stem cells. The lab I use is in Florida. They take, a woman gives birth and they collect the placenta, which otherwise would normally go in the trash, right? It's considered medical waste. And so they take the placenta, they isolate the stem cells, and then they basically stress the stem cells out, trick them into thinking that their host is under duress. So they manufacture and excrete these exosomes. They centrifuge out the stem cells from the exosomes. So we're separating out the other person's genetic material, just isolating the exosomes. And then we supplement a patient's own bone marrow and fat stem cells with these exosomes. And what we think that does is it actually makes their stem cell functionally that of a younger person. Yeah.
Wow.
Then,
go on.
and then we just once we have this mixture, bone marrow and fat stem cells with exosomes, we go ahead and inject it wherever it is. If we're treating intervertebral disc, if we're treating the neck, if we're treating the shoulders, whatever it is we're treating. And we have a product called Full Body Stem Cell Makeover, which I developed for Dave Asprey, which is where we do everything. We just do like literally the entire body, every moving part of the body in one sitting.
Wow. And the needle that goes in is quite long from what I've heard. And like you're weaving your way between things and like really.
If I'm doing discs, yeah, sure. The needles are long. That's right.
Yeah,
you're thinking about the Mind Valley talk. Talk. Yeah.
It's incredible just thinking about the accuracy with which in this day and age you can target things within the body to heal.
It's that's with the use of X-ray guidance, you can put a needle in very precisely anywhere you want to go.
Incredible, man. You were talking a little bit about there was a point there where the penny dropped, and we were talking about stem cells and the difference between chronological age versus the difference between biological age. Can you explain it to us what like stem cells can show us about that?
Sure. So there's, chronological age is just how old are you? And I'm 52, it's based on your birth date. Biologic age, of course, is how robust is your cellular function? How well are your cells operating? How well are your mitochondria operating? Just what are the mechanics of your overall cells? And largely you can look at somebody and get a pretty good idea. There's people who look a lot older than they actually are, and there's people who look a lot younger than they actually are. Part of it is genetics, but a big part of it is lifestyle. And that's, that's all the stuff we talk about in biohacking, which is, learning how to eat well, exercise well, sleep well, and be well emotionally.
And so in there, like the biological age piece, and we talked about this a little bit, you said emotionally being well as well. There was a conversation that you had, and I think it was potentially the same. Anyway, it doesn't matter. One of the things was we were talking about you mentioned longevity and the connection to longevity and having meaning and living on purpose, and how those lifestyle factors played a big role in how you showed up in terms of this biological aging. Well, can you tell us a little bit about? Like it's just interesting from my perspective, as you know, I've got the bias, the purpose guy, sort of looking into how purpose plays into longevity.
Sure. So as I mentioned, low back pain is the #1 leading cause of disability worldwide. And if you look at the global financial impact of pain and low back pain specifically, pain is more costly than diabetes, cancer, and heart disease combined. I mean, it's staggering if you look at the numbers. But the reason those disease processes, diabetes, cancer, and heart disease, get so much attention is because they kill people. Pain doesn't particularly necessarily kill people. So it gets a lot less respect and attention than it should. But if you look at, all the studies around longevity, one of the major predictors for living long life is having a purpose in life. Well, if your purpose in life in any way involves the use of your body and you're unable to move because you're in pain, well, then your purpose in life is very much threatened by the chronic pain that you're living with.
Thank you so much for highlighting that. And so, Harry, you've been doing this for almost 20 years now. Where to from here? Like, I know you've just been growing and growing and growing and finding new and more interesting ways to, to help people heal and invoke that healing cascade through these interesting and cutting edge ways. Do you feel like you've arrived? Is it consistent growth? What's going on in there in your world? What's next in the horizon?
Well, it's, there's two main categories in the world of stem cell medicine. There's what I do, which is regenerative medicine, which is where we just take the stem cells from one part of your body and move it to the area where you need a little help. And then basically stepping back and letting nature run its course. The other area is tissue engineering, which is where we're growing stuff in laboratories. So, anything from like kidneys and hearts to meniscus and potentially entire joints. To be surgically implanted. Now, that's something that's very much in the early stages of research. But I really think in our lifetime, we're not going to put titanium in people's knees or hips anymore. It's going to be growing people's own joints and replacing with those. But that's sort of a long way off. Here in the realm of regenerative medicine, here in the US, for instance, like for what I do now, like I'm very happy with the outcomes, but I mean, that's sort of been the thread of my entire career as I get to a place and I'm like, man, I can't get any better than this. And then like the next thing comes along that I had no idea that I never would have expected it. So, I mean, that's sort of how I feel now. The main thing that really does need to happen is we need to work out the regulatory stuff because there's some stuff like bone marrow stem cells, which are very clearly legal and kosher. There's some things like fat, which is a bit of a gray area. And then there's sort of these other things like the exosomes, which are going through the regulatory pathways. But like, I'll be a lot more relaxed when they've completed the regulatory pathways. So, I think that the main thing we need to figure out is just like what's legal and what's not legal and what's in the middle. So beyond that, I just have no idea. I don't know what the future holds. I'm doing my best to sort of stay on do what I can to contribute, which is why I came up with full body stem cell makeover.
I love that. Thank you so much. And just a question from, I guess, my perspective, like a consumer's perspective. Are the most of the people in performing stem cell therapies at the moment, are they all about of equal keen, or is there a difference? And in terms of if I was to find someone here in Australia, or is it worth me making the trip all the way to Salt Lake City to come see? What do you?
It depends on what you're having done. If it's something, there's the thing that's interesting about stem cell therapy is there is no formal pathway to becoming a stem cell doctor. So it's not really regulated, and there's not formal trainings. So, buyer beware for sure.
Cool.
You need to really research, for whatever your condition is, you need to research the doctor that you're looking at, see how much experience they have. One of the things you always want to make sure that if you're treating musculoskeletal conditions, you want to make sure that they're using some form of image guidance, whether it's X-ray or ultrasound. We use both, just depending on what it is we're doing. Like X-ray is great for spine, but ultrasound is great for like rotator cuffs and tendon insertions and that sort of thing. So, you definitely want to make sure that they do one or the other, or preferably both. The other thing is, what kind of stem cells do they use? Is it bone marrow? Is it fat? Or is it just umbilical cord? Because when that gives you some indication of the seriousness of the clinic. There've been something that's been very popular here in the US are these clinics that just like buy the umbilical cord stem cells and don't use any imaging and make these, ridiculous promises and just, so, there are bad actors out there. So you just need to sort of, do your own homework. For what I do, for especially like the spine treatments, the disc injections, there's very few places in the world that do that. So, when you get sort of to that level, the choices get narrowed. And then full body stem cell makeover, clearly, like I'm the only one
place to go to that.
Yeah. So, we get people from Australia, we get people from all over the world. We get quite a few from Dubai, Europe, and I mean, not so much now during COVID, but things are starting to open up, and those calls are coming back through.
Awesome. Thank you so much for sharing that for us as well, Harry. And one of the questions I've got is, over time, like the therapy is becoming more and more affordable?
So not really. And the reason is, I mean, it's sort of yes and no. Like it is becoming more affordable for the really simple stuff. But like take me, for instance, what makes, cause I'm about average in the industry. I mean, it might seem kind of expensive if you just hear the number, but if you realize how much is packed into one treatment, it's actually a really good value. But what makes it tricky is it's sort of like the hospitality industry. It's like Four Seasons Hotel. You've got expensive facility, you've got expensive equipment, you've got expensive people, and then, and then all this other like malpractice insurance and everything else. So it's expensive to do. So I don't really see, like, I think there's certain elements that are going to become more affordable with like the manufacturing part. So like this stem cell, umbilical cord derived stem cells or something like that, as a medication, when that's going to become more affordable, because that production, that's sort of the manufacturing side will streamline, and that will become more affordable. But for the actual, like what I'm doing, unless we get robots doing it and you have a lot of expensive people in an expensive facility, I just don't see how it's going to become a lot less expensive.
Gotcha. Awesome. Thanks for clarifying that, man. And I just wanted to, before I wrap up, is there anything else you wanted to share with the audience about?
Well, just on that note, that's why I created the Tithing program. We have a Tithing program where 1 day per month, because, I figure the greatest advancement in medicine doesn't do anybody any good if they can't afford it, right? So I created the Tithing program. So the Tithing program is 1 day a month. We perform procedures on the medically underserved at no charge. And the way we do it is, first somebody has to like demonstrate that they're living below poverty line. And then once we've determined that, then there's two pathways. One is for combat service veterans. Here in the US, if you've, fought in a war, we'll gladly treat you for free. The other pathway for people who are not combat service veterans is I will do the procedure in exchange for documentation of community service hours. So like for knees and hips, I'll do 60 hours. For a spine treatment, 100 hours. And we on my website, we talk, it's Habitat for Humanity, VA system, Boys and Girls Club of America. I picked sort of one for kids, one for homeless, and one for vets.
Awesome. That's so
Yeah.
beautiful. Thank you so much for that. That's really inspiring to feel into just all the intentionality behind everything you're doing to serve people as well, man. Thank you so much. And
Oh,
yeah, I really sincerely hope those that are tuning in, curious about stem cell therapies. A big intention for me around this episode was to like the questions that I asked you a little bit towards the end. I know that there are some people in the space, but also bringing people
mhm,
home to a place of, dare I say, authority, somewhere
mhm,
safe, look after yourself, please be kind to yourself, go to the place
mhm.
where, you get the treatment that you deserve. For those that want to check out Harry's work online, Google him. We'll put the link to to his website in the
Yeah, and
show
please check
notes as
out my
well.
film too. I have a 60-minute film that sort of tells the whole story, which is the stemcellsolutionfilm.com. It's free to
Easy.
watch and hope you enjoy it.
Perfect. So we'll link that into the show notes as well. Harry, thank you so much for being here with us today.
Oh,
Really appreciate your
well, thank
time,
you
your
for all the
presence.
excellent work you're doing over there on the other side of the world.
And we know it's not just today, it's a lifetime's work that's informed this, at least 20 years worth of actual clinical practice that's come into today's conversation. So thank you so much for, again,
Oh,
all that work that you do that informs this. And on behalf of myself and the Inspired Evolution community, all of us tuning in, we're wishing you all the best with your work as well. And you'll be hearing from us soon for sure.
all righty. Thank you so much. Bye-bye.
Hey guys, if you enjoyed this video, give it a like, leave us a comment. And if you want to stay in tune for new episodes launching every Monday, hit subscribe and I'll see you in the next video. Stay inspired to evolve.
Cause it's safe from my soul.